Today, a pharmaceutical company is sharing relief items to residents of Fumesa in the Ashanti region of Ghana. The government's partial lockdown has taken a toll on the people, mostly artisans. Unlike others, Nana Kwesi requested for a nose mask. The donors had earlier told him they had run out of stock, but later managed to get him one with a torn band. The young man wouldn't mind wearing it in that state because he wants to protect others from a cough he had been experiencing since the previous day. I've heard the symptoms of COVID-19 include coughing, sore throat and others. Though I've been coughing since yesterday, I wouldn't know if I have COVID-19 or not. In defiance of Ghana Health Service announcement for people with symptoms of COVID-19 to stay home and call designated call centers for attention, Nana Kwesi is bound for the hospital for checkup. According to a report published in the Journal of American Medical Association, somatic symptom disorder is a persistent fear of undiagnosed medical condition. The authors note that it affects 5% of medical outpatients. In the wake of coronavirus, anxiety is all-time high. What about somatic symptom disorder? Your guess is as good as mine.
This one, can you be telling me all that?
Right, so...
Okay, yes, and there was another...
A team of experts from Knust School of Public Health has developed the web-based app called COVID-19 TechPort. His brainchild, Dr. Sin of Knust Hospital, says the innovation was informed by the need to reduce excessive doctor-patient contact during this period due to the risk of cross-infection and reduce exposure to healthcare workers.
That we want to reduce contact between a doctor and a patient as much as possible, because we really don't want people to be coming to the hospital settings, because those are sort of the most risky areas to be coming at this point. So we can see there's a lot of people.
Dr. Sin leveraged her experience in the use of technology for control of non-communicable diseases such as diabetes and hypertension with the support of the Dean of Public Health, Professor Ellis Usu-Dabo, and Kenneth Asante-Usu of the University Information Technology Services to design an app that can be used to assess risk for COVID-19.
It was also in an effort to reduce the anxiety and panic that is being caused because of COVID-19, so that patients or people can sit in their homes and have the luxury of using their phones or their computers to be able to assess their risk.
The app, which is now a free web link, was designed based on guidelines from the World Health Organization and Ghana Health Service. It gives assessment based on answers composed from 8 questions.
And it starts with a welcome address telling you about what it is for and then where the guidelines are coming from. And it goes ahead to ask you about your age, where you would feed in your number. So the age is the only place where you would actually type in a number. But all the others, the remaining 7 questions, with a multiple choice questions with different scores. So like travel history, then we have medical conditions, if you have previous medical conditions, the symptoms you have, do you have a fever, do you have a cough, do you have a shortness of breath? So it takes you through all that. So we've had 6,000.
The tool provides a final risk assessment of the individual ranging from low, medium to high risk.
And tells you the actions you have to take. So it gives you the helpline numbers, and like I said, some of the helpline numbers are from the Ghana Health Service, and then it tells you on certain instructions like whether to start home isolation immediately, avoiding any contact with family members.
The app, which was deployed in the first week of April, has had more than 6,000 responses already.
Since we deployed on the 3rd of April, there's been over 6,000 responses or assessments, and most of them are low risk. That's over 4,000, and then a few of them, about 86, are high risk. Hello, good evening.
So what are users saying about the app? Bright Arthur, a front desk executive, is not new to healthcare apps.
That starts with you indicating your symptoms. Then maybe I'm having a headache.
Though he's satisfied with TechPort, he thinks it could be a bit personal.
I'm a customer service person, and then I meet people. Do you understand? But what I'm trying to talk about is, if my meeting people, I won't know if they have it or they don't. Do you understand? But they categorize the whole thing and they like into bracket this, into bracket that, into bracket like they grouped all together. But if they could segregate it, then it will expand more.
Bright also thinks the final assessment of low, medium and high risk should be quantified.
It should give us a percentage via. Then that one will also help in educating people that okay, even I'm in the low risk, maybe I'm at least 75% in the low risk category. Still, then I need to do more.
Unlike the GH COVID-19 tracker developed by the Ghana Health Service, which demands personal details such as mobile number and email ID, TechPort doesn't.
We wish we would have one of the questions or one of the items in the app that would be able to detect the patient's location. But just because it will give us access to the patient's, like it's an identifier of the patient or the person. So that is one limitation. If we could get the locations based on where people are answering these questions from, then at least for those people who might be in the medium risk or high risk, we might be able to have access to them and then maybe organize a surveillance screening or something for them that we wish moving on into the future we can add that item to it so that it will add more value to whatever we are collecting. So like I said
with the
earlier,
virus
the
becoming
program
more
we have is
complex
called
to
the
manage
COVID-19
amid
TechPort.
potential extension of lockdowns, digital platforms such as TechPort will come in handy to augment platforms like the one launched by government to quell the number of infections.
4,100.
You might want to give it a try.
Then we have very few
Reporting for Joy News,
just
Kwesi
so that we
Deborah.
could have gotten the location.